talk to you today about preparation for pregnancy. So there is something called as pre-pregnancy counseling, where everyone visits a doctor before, a gynecologist before, when they are planning to have a baby. But there is not enough awareness of this in the public. So when I say planning your pregnancy, everybody thinks in terms of whether they are ready to be pregnant, in terms of profession, in terms of finances, in terms of relationship and emotions. All of these are the factors that most people consider when they are planning a pregnancy. But what I would like to highlight upon today is whether you are in the best of your health to get pregnant or not. So in pre-pregnancy counseling, the things that we address are, first and foremost, if you are in the perfect health or not. We will evaluate adequate history from you, all of your medical background, whether your general health condition is good. Now, starting with weight problems, we need to make sure that you are in the perfect weight range to have pregnancy. If you are very underweight or if you are very overweight, we will ask you to have your weight reduction or weight gain before planning for pregnancy. Now, coming to diet, anybody who is planning to get pregnant would need to make certain diet changes. So starting with the first and foremost thing I would like to highlight on is increase your fruit intake. Increasing your fruit intake reduces the chance of having preterm deliveries, reduces multiple complications during pregnancy. So that is the first and foremost thing. The second thing is you can have high calcium diet, you can have high vitamin B and B12 diet. All of this will ensure having a smooth pregnancy process and your delivery process also. This is about the diet. So if you do have some pre-existing medical conditions, some of you might be diabetic, some of you might be high blood pressure, some of you might be having a thyroid issue, hormonal issues, irregular periods, all of these will have to be addressed beforehand. If somebody is a diabetic or having a high blood pressure disorder, not all medicines in diabetes and high blood pressure are safe for pregnancy. So anybody who is normally taking a set of medicines for, let's say, diabetes, if you meet your gynecologist and tell them that you're planning to have a baby, we will be changing those medicines, giving you the safest ones. So in case you do conceive immediately, so the first 4 weeks or 6 weeks, that is the first 1.5 months of your pregnancy also, where your tiny embryo will be exposed to these medicines, we make sure that they are being exposed to the right kind of medicines and not the ones that are not safe for pregnancy. Along with this, there's something called as prenatal vitamins, which most people are not aware of, and they think that prenatal vitamins should only be taken during pregnancy. So there is something called as folic acid. This I want to stress upon harder. Folic acid tablet should be taken for 3 months before you become pregnant. That ensures perfect early embryo development. So the chances of abortions will be minimized to a large extent. Apart from this, the other smaller things I would like to highlight on is there are certain viral infections which if you do get when you're pregnant, can have a major impact on the baby. Something called as rubella vaccine, something called as chicken pox. All of these, if you get in pregnancy, they have a very major impact on the baby. So if someone hasn't had rubella infection before or chicken pox infection before, so they can take the vaccine and keep themselves safe so that during pregnancy they won't get that infection. So these are the vaccinations that we provide, and yearly, seasonally, Influvax will be given. These are influenza vaccines. These are flu vaccines basically. So seasonally and annually, the types of flus keep changing, and you should make sure you're updated on those vaccines so that you don't have to, have the need for taking a vaccine while you're pregnant or get attacked with one of these flu viruses while you're pregnant. And so this is what comprises of pre-pregnancy counseling mostly. So make sure that all of you have a pre-pregnancy counseling.